In the dimly lit dialysis ward of Ayder specialized hospital, rows of patients lie in silence, their face edged with pain and exhaustion. For many, the battle against kidney failure is compounded by a lack of essential medical supplies, including dialyzers, IV fluids, and medications. The hospital, once a beacon of hope, now struggles to meet the growing demand for life-saving treatment, leaving patients and their families in the state of despair.
ይህ በሽታ ንቅለ ተከላ ካላደረግሽ ኩላሊት እስካልቀየርሽ ድረስ ወደ ህይወትሽ መመለሳችም እየታከምኩ ህይወቴ ይቀጥላል ማለት የለም። በጣም ከባድ ነው።
I sold my car to pay for my treatment, but without government support, managing with children is impossible.
Dr. Kubram Gabraslasy, director of the Ayder Comprehensive Specialized Hospital and the Health Science College, explains the challenges behind the hospital inability to provide necessary medication.
Public-private partnership.
We initially collaborated with the private sector under a public-private partnership model. Under this arrangement, Ayder Comprehensive Specialized Hospital and a Sudanese medical supply company each held a 50% share. This model was implemented in several Ethiopian hospitals but was discontinued in other government facilities due to a lack of profitability. To sustain the service, we decided to forgo our 50% share. This allows patients to receive medication free of charge, with their only expense being the cost of external washing services.
Dr. Kubram also highlighted that the hospital provides free medical treatment for patients who have lost blood during childbirth, thanks to a dedicated budget.
We do not charge mothers who have lost blood during childbirth, as we have a budget allocated for their treatment. Their health can often be restored after 2 or 3 dialysis sessions. However, covering the costs for patients who require lifelong dialysis is challenging and requires government support.
Kidney patients require dialysis at least twice a week, with each session costing over 4,000 birr. Dr. Kubram emphasized that the urgent need for government intervention to address the financial burden on patients.
Patients pay more than 4,000 birr for a single dialysis session and require it for the rest of their lives. Given the high cost, there should be institutional insurance or a dedicated fund in a secured account solely for this service.
To address the crisis, the hospital is exploring innovative solutions, including the sale of fundraising cards.
We are preparing a card that will cost 25,000 birr, which anyone can purchase. The funds will be deposited into a locked account, and we are working on this solution to address the patient's crisis.
Ato Haftam Abadi, head of the Tigrai Kidney Patients Association, revealed that more than 100 patients have died since the Pretoria Agreement was signed. As the crisis continues unfold at Ayder Specialized Hospital, patients and staff remain a constant struggle against the limited medical supplies, high treatment costs, and the urgent need for government intervention. Despite the overwhelming challenges, Dr. Kubram and his team work tirelessly to find solutions, offering a glimmer of hope to those in need. The call for support is clear. Without it, life hangs in the balance.